Good afternoon. This is Professor David Weiss, speaking again from New Jersey City University's Institute for Dispute Resolution and its continuing Connecting Bridges and Borders podcast programming. Today we have a wonderful and fascinating discussion on the Sikh community. And with us today is Rajnarind Kaur, who represents and is on the board of NAZMA. And she's going to tell us a little bit about their work in the field of public health care. Welcome to the show today. How are you?
Thank you so much, David. I'm well. I hope the same for you.
Doing well under the conditions that we're all dealing with today in this new era. So first, why don't you tell us a little bit about yourself and how you got involved in NAZMA, and also just in general, a little bit about your background for our viewers today.
Sure, thank you. So Wall Street has been my entire career. I've worked at JP Morgan Chase, Credit Suisse, Deutsche Bank. And now, given the current opportunity, I'll look at it as, I've been able to pivot a little bit, presented this current situation, and I've been actively getting involved in nonprofits. I'm on a nonprofit board here for Middlesex and Somerset County, known as the One Project. And that basically is inspiring people from all backgrounds to work as one to make a difference. Along with that, the NAZMA came along and I had the opportunity there to begin working in editing and disseminating information, dubbing, translating documents from English into Punjabi on all the COVID-19 information that's out there for the wider South Asian community.
That's very fascinating. So before we talk about NAZMA, you brought up this One Project, and I'd like to just understand a little bit for our viewers what that is also about, because that sounds very fascinating as well. And then we'll move into a discussion on NAZMA as well, because I'm sure they're interconnected in terms of your community volunteer and community support that you provide.
Yeah, so I was selected for the One Project board as well earlier this year. So we met, actually, I think we had one meeting in person where we were able to meet everybody, and then everything happened with COVID and the lockdown. But the One Project has been around for at least 6 to 7 years, and their main project that they do is in the summer, where it's ending, it's like feeding the hungry. So we get everyone together in Robbinsville, it's based in Robbinsville, and we basically assemble packets of food, of dry lentils and herbs and spices, and package them through, and then we formulate assembly lines, so it's from 9 to 1, and we bring in everyone under the sun, essentially, and we make the meals in an assembly line fashion, and it's 1 hour, 1 day, where we package over 10,000 meals. That's
amazing. And do you have volunteers from the high school or universities also participating?
Absolutely. So Robbinsville is the key center location. So all of Robbinsville, in fact, the entire Robbinsville community comes together. And then I got involved, I live in Monroe. We got involved through the connections that we have. So now it's all of Somerset and Middlesex County that comes out there. We had booked the date. We were like all excited. We were ready to go. And now just due to what's going on, we're not sure where we're going to go at the points. We actually have a board meeting coming up next week.
Well, I do hope they find a creative, innovative way to be able to have that project happen this summer, because I'm sure that the constituents that are served by this great act of volunteer and compassion will be eager to still receive those packets that you all put together.
But we are being creative as well in what we're doing now. So we're putting together a Spirit Week. We are getting our student scholars out there and still actively involved in doing webinars like this to just kind of connect with the communities, because the whole point is to bring the community together. Since we can't do that, we'll do it virtually.
Fantastic. And for our viewers, if there's anyone of interest in this One Project, we'll certainly provide details on that along with the podcast at the bottom of our screen. Let's move forward into NAZMA. Tell us a little bit about that.
Sure. So NAZMA stands for the North American Sikh Medical and Dental Association. It's the largest Sikh healthcare professional organization in North America, so United States and Canada. It's basically, as you said, it's creating a community of Sikh healthcare expertise. And we have individuals who are on in the organization that are connected, I guess, by their strong faith in Sikhism, but also through their commitment and dedication to the healthcare field. In essence, they provide a variety of resources and activities and information out there to serve the broader Sikh community. But now what we're seeing is we're serving the entire South Asian community as well.
Wow. And how many members are part of the organization?
I think to the last date that I spoke with the president, we had over 1,000.
So it's a very mobile and strong organization with a large diaspora between Canada and the United States.
Absolutely.
And what are some of the projects currently that NAZMA is working on within their community outreach regarding public health care that you can educate our viewers and listeners on today?
Yeah, absolutely. So a lot of the members right now are on the front lines. So they're fighting COVID-19 day in and day out, and they're actively letting us know what's going on so that we have firsthand information. In addition, we're able to provide the expertise in translating a lot of the information that's coming out from the CDC. So while it's all in English, a lot of the South Asian community, many of them are immigrants, and they may not be actively learning English or as fluent in English. So we're translating a lot of the kind of information that's coming out, whether it's social distancing, whether it's, just stop the spread, how do you wash your hands, getting the information out there. And many of the individuals that we're serving, we're finding out may not even be on YouTube or on the websites that are out there. So we're handing out flyers. We're just getting the information out there in Punjabi to the transportation industry, because many Punjabis drive trucks. So we have to provide them the safety guidelines of the transportation industry.
And that's really interesting point that you bring up, that you're really using methods that are very front line with passing flyers out. Has NAZMA been able to build or foster some relationships with other community platforms within the wider community that NAZMA is serving, such as universities or local community chambers of commerce or other sort of mediums that could assist in the process?
Yeah, absolutely. So what a lot of the network within the Sikh community, we're all connected. So there are a lot of Sikh student associations at universities. So we're able to spread the word of NAZMA.org out there, which has all the flyers in both English and Punjabi. So a grandchild can see that the information is out there and then print it out. We're not actively printing out and handing out stuff. It's more like spread the word, get the word out there, and show your grandmother, that this is what's out there and you have to understand it. Please don't just think that you can go to the Gurdwara. It's not normal times right now. Just be a little bit mindful and be careful.
And are there other certain cities or locations that, in your opinion, that are really taking a dedicated commitment to assisting NAZMA in this process that you can share with us?
Yeah, so I mean, the big ones are California, Los Angeles. We have a huge team out there that's working, and we try and benefit the time zone difference here. So if we're working on something, then they'll pick it up while we're sleeping. We'll pick it up when they're sleeping. California has been huge help. There's a number of organizations that's working with NAZMA in disseminating the information. A lot of the doctors are out there. And then obviously New York, we have a whole slew of other Sikh organizations, as well as the wider South Asian organizations that are out there kind of getting the information out to the public. So is everything just focused on the Sikh community. It's in Punjabi. So we've already somewhat made it in the cultural sense of the word of taking the CDC information and making it culturally acceptable. So then all they have to do is just translate it into Hindi or Gujarati or another language of the many dialects of India.
And I was going to ask that question since, and I think you sort of raised that point, that it's not just for the Sikh community, but for those in the Punjabi community, which is a larger community within, not just within the Sikh community. What I haven't heard, and I'm curious to hear about, is what are you doing in New Jersey or what is New Jersey doing in, for example, Hudson County, where we sit at New Jersey City University? I mean, there must be a large, as the most diverse city in the country, we must have a significant Punjabi population.
Yeah, so through the Gurdwaras, through the communication, through opportunities like this, we're getting the word out about NAZMA. So our website's up, the flyers are up, the YouTube channel is there, the Instagram is there, all social media is covered. So it's really just now getting the word out. The information is there, and furthering it out within the community. So again, it's through the gurdwaras and through other organizations. So I was able to participate, and it was provided the opportunity to speak about mindfulness through the Muslim community. And same thing there, I talked about NAZMA, I talked about, you know, the topic that I was supposed to talk about, but of course I did a plug for NAZMA as well.
And when we talk about sort of the public health care mission, can you give us a little insight on what are some of the things that you're doing both in the public health care, and also what some of the challenges are that you're facing?
So I think that one of the biggest challenges is the dissemination of information that we found. So just the sense of, if there's a mother who possibly is infected, how is she going to nurse her child? So we're putting together the information around that, of that it's still okay to nurse your child, and how do you do it based on what's been given by the government or by the healthcare experts that are out there. So we're taking that information, translating it. We are culminating a lot of the information from many sources, and then coming up with a checklist. So similar to what I mentioned before of the Punjabi, within the transportation industry, we have a lot of individuals that are still driving. They still have to do their deliveries. They still have to work. So how do they protect themselves? So it's, again, getting the information out to them. So creatively, we had to really come up with a checklist, then translate it into Punjabi. And then just recently, I dubbed it for the radio so that they could play it while they're driving. So that they know that, okay, I need to make sure I have disposable gloves. I have, you know, the sanitizer in my truck at all times. I should be able to protect myself at any time. And they have that checklist with them, even though they're not on the website.
Well, I think that is so important, and it's something really that I don't think a lot of Americans recognize, which is that while the CDC puts out these guidelines, that not everybody understands or can read or comprehend them, because they may be first generation Americans or recent immigrants to the United States. And we would assume wrongfully that if they're driving trucks, that means they're working for a company or for a trucking transportation organization. And these organizations are not thinking about this gap in the system. So you're really providing a very crucial element to keeping their workforce healthy.
In addition, David, I mean, culturally, there is the whole huge aspect to it as well, that the shame that someone may feel if they are infected. And do they want to tell someone so that they can then protect the others? So there's all that kind of understanding of the culture, and making them aware that they would, in fact, if they do come forward, if they do have something, which we just had recently, a family, the daughter, I believe she's 15 years old in Massachusetts. She just wrote a whole article saying, this is what we did. My father had COVID. I then got infected with a milder case. And she explained what she did, what they did in the house. He was upstairs, she was downstairs. The mother and her brother stayed separate, and they kind of took care. So it was a firsthand experience in saying there's no shame, just let's protect each other, let's protect ourselves in preventing this pandemic from really impacting our lives in a worse way than it is already.
So do you find that there is a wide disconnect between what is sort of mainstream English or Spanish, because certainly Spanish is heavily communicated throughout most of the states in the United States today, but do you find that there's a dislocation in the communication, which NAZMA and other organizations like yours are filling a role, it sounds like? And I guess maybe my question is what about the employers? Are they aware of the work you're doing to help keep their employees healthy, safe, and productive, which is part of rebuilding our economy in the state that it's in right now?
So yeah, I think there is a disconnect. We found we were at a loss sometimes for words to translate from English into Punjabi and vice versa. So we definitely saw the disconnect. Regarding, I would say, the transportation industry, a lot of the owners of the transportation trucks that are being driven are, in fact, Sikh and are in fact Punjabi. So we're actually at a, we have a opportunity there to really work with them to kind of make sure that their truck drivers are protected. Where in the case that the employer is not, we do try and at least make them aware of what we're doing, but directly straight to the truck driver itself, or the cab driver or the limo driver, or whoever's out there, the taxi drivers that are out there.
And what type of reaction are you getting from the non-sort of Sikh or non-Punjabi employer?
Yeah, they welcome it because it's helping them educate their employees so that they can continue working. So at the end of the day, I'm sure they're definitely, they've been very welcoming and embracing whatever information that we can provide.
That's good to hear. Let me focus back to the public health part that NAZMA focuses on. Can you give our listeners a little bit of more of sort of the scope of things that you focus on beyond just the translation part of what Punjabi community wider at large, beyond just the Sikh community, is doing with COVID-19? What else is it focusing on, or are they working on different novel ways of helping local community health improve its system? Maybe you can sort of expand on that for our listeners.
Sure, absolutely. So NAZMA as itself is an organization that was created and the president right now is one of the individuals that was there at 9/11, right at the front line. I mean, he was there right when everything happened. His name is Dr. Navinderdeep Singh Nijjar, and amazing individual. And through him, I got connected and involved. And I'll say that some of the stuff that I've been hearing about NAZMA, because I only just got involved, is all the creative ways that they are bringing back to India. So really kind of helping the healthcare industry in the villages in India where they may not have such a structure as a mainstream city would in the hospitals or the healthcare that they can provide. So what NAZMA does is they have projects that they can then work on here, or have our interns or work with our recent graduates who are involved within the community but have an interest in the medical field. Then they can brainstorm ideas and then take them back and do what they can in different areas of the world, not only India.
That is really interesting, because what NAZMA really does is it has a internal our commitment to our own community healthcare system here, but it's also then exporting that around the world to other locales like the Pan-Pacific Asian region, as well as India, through its experiences. It's almost like a Doctors Without Borders process. That's very fascinating. Are you finding a correlation back, what I'll call inbound, where some of the experiences in the local villages and some of the knowledge is being harnessed, for example, in India, is being brought back this way in order to assist NAZMA on its local community outreach, especially for those that perhaps don't have healthcare, obviously don't speak the language well, are disconnected in terms of, what we call in the shadows within our economic system, but are part of the economic system and are Americans or first-generation immigrants and are part of the fabric of our country. How is that working? Is there an inbound relationship for understanding and applying new methodologies as well?
Yeah, I definitely think there is. There's always an opportunity to learn both ways. And I think when we're out there in the field, in the village, and you're working with someone and you're learning how to communicate that way, it also works the other way. So that when we're back here, we're able to then, if we come across something similar or a similar experience, we're able to then relate back and have that bedside manner and compassion and empathy that all doctors need and should have.
And how hard hit currently has the Punjab community been with COVID-19 at this point? I mean, the reason I asked the question is that you raised something which we discussed a few minutes ago about the trucking industry. So I think of frontline workers, which of course are really champions for many of us, like the doctors and nurses in the hospitals, because without the frontline workers, we won't have a supply chain. Our products wouldn't get delivered to the supermarket. So they're just as important and vital, in my opinion, as our doctors and nurses are. So are you finding a lot of exposure of COVID-19 from the NAZMA experience?
So I think culturally, there is that aspect too. So we've been hearing stories. I know in England, there were several doctors that were infected, and I think some actually have actually passed away. So I think that there has been that impact there. There also has been cases where people are affected and then they get better. But to have a handle on it, it's very difficult. I know in New York, we've been hearing many of our elders in the community have been hit, and then they come out and they say that, you know, they're better now, and that it's Mythbusters, what we call it in NAZMA. If they say, oh, you know, if I just drink some ginger and lemon water, I'll be okay. No, I think from the experts we've seen at NAZMA, we have a Mythbuster out on our website as well. It's not just that. You really need to be careful and follow the guidelines. But some people have been lucky, and they've been able to recover. Some have not within the community, and we've also seen many individuals pass on, unfortunately. So it's two-way, but I don't think that we're getting a full understanding of everyone that was impacted, just because culturally not everyone's telling everything.
And you raised two really, I think, important critical points that I'd like to explore for a minute. One is this Mythbuster comment you make, because in fact there was a recent newscast discussion in Africa where they're using these sort of remedies and saying that they will cure the COVID-19. I'm not suggesting I know whether or not they can or they will, but reminds me of sort of that commentary I saw recently on the news, the mainstream media. So how do you approach these Mythbusters in a way that is respectful, given the close-knit of the community, but also, to your point, this sort of stigma where they may not want to really talk about the COVID-19 exposure themselves? How do you address those challenges within NAZMA?
So I think through NAZMA we have a unique opportunity. Many of the healthcare workers are also active in the community. So individuals are bluntly just going up to them in Gurdwara and saying, oh, I have this, if I do this, will I become okay? And they can very nicely, based on their expertise, say, no, it's not going to be okay if you just do this. And then from that, they get the experience and the information that then we put in a Mythbuster. So right away, it's so timely, like everything that we're doing, it's like turning around so fast. Like when this all happened, I think we were working around the clock, just getting the information out there, posting it up, and educating the community. I would say one of the things that Sikhs do, and I wanted to mention this, so I'm gonna kind of just, seems like a good place to do it. You know, Sikhism is based on three tenets that I really feel we should explain a little bit here, and it's the fifth largest religion. Not many people know about it. Three basic pillars are Simran, which is mindfulness and meditation, Seva, which is selfless service, and Sangat, which is surrounding yourself with like-minded individuals. So while I was saying that the healthcare individuals are out there in the front line, they're also surrounded by their community. So they're able to give the timely information right back to them. And the selfless service is huge, huge within the Sikh community. I mean, I know many articles, many news clips were out there on the Sikh community where the New York mayor, New York City, the emergency management system, they kind of reached out to them, said, can you help us? We need to feed 30,000 meals. You know, in Canada, they did a huge blood drive, the largest of its kind. It's all based on that selfless service tenet, that they're out there volunteering, doing everything along with the front line, along with the transportation industry, and then also just getting out there and volunteering.
Well, that is an amazing way, I think, for our listeners to really just take in what we've discussed today as a great conclusion, because I think these three tenets, which, you know, I hope are not just within the Sikh community, but within the soul of all human beings, because I think they're wonderful attributes that if just each of us sort of focused a little bit more on it, we can make a better world.
Yeah.
I want to thank you today for sharing a little bit of insight on what your dedication. It's amazing. I want to thank you for what you're doing. the good work of One Project and NAZMA, and also sharing some insight on the Sikh community and their beliefs and what they do and the importance of what the Sikh community is doing as a backbone to our economy and to be part of the American story. And I really appreciate you coming on today.
Thank you so much, David, for the opportunity and everything that you're doing and the connection that we have as well. I mean, it's been an amazing experience. So I wish you to be safe. All the listeners, please stay healthy, and looking forward to more podcasts.
Thank you so much. And once again, this is Professor David Weiss from the Jersey City University's Connecting Bridges and Borders program. We hope you enjoyed today's discussion on the Sikh community, as well as new information that I've learned and I've really enjoyed. Until next time, I bid adieu. Take care.